Hello, Dr. Tugbiyele here, Urogynecologist, and in this video we're going to talk about some of the complications that can occur as a result of childbirth. And so for many women and their families, they are looking forward to growing their families, having children, and it's a joyous occasion. And thankfully, most times when women have children, it is everything works well. But there are times when things don't work well, and there might be a complication or so, and it's important for women to know that there are solutions that they have that can improve their quality of life rather than feeling like they have to live or put up with it. And as urogynecologists, that's something that we care about, that women know their options and can actually move forward with improving their quality of life. And so during childbirth, it can be either vaginal childbirth or a cesarean section. There's certain organs in the pelvis that can become injured as a result. There's the bladder or the bowel. There are blood vessels, there are nerves, there are ligaments, pelvic floor muscles, bones. And so those are all the things that can become injured. Some women can, when we talk about bones and or ligaments, some women can develop a pubic symphysis separation where unfortunately during pushing the pubic bone and the ligaments become so stretched that they actually separate, and that can cause pain. When it regards to bladder and bowel, if the baby's head is compacted down there for an extended period of time, it can compress blood vessels and or the organ, the bladder. And in some women, depending on how long that occurs or how much pressure or tension that creates, that can increase the risk of fistula, which is an abnormal connection between the vagina and the bladder. And I have another video that I talk about fistula, so you can actually refer to that for more detail about fistula, but that's something that can occur as a result of vaginal childbirth. Or even C-section. If there's an unrecognized injury from the bladder to the vagina, that can cause a fistula. With regards to the bowel, some women after having their children vaginally, if there's a tear, we call it a laceration, or if an episiotomy is done that's extensive and there's still and it's either not repaired in the best of ways, or if there's an area that wasn't recognized as torn, then that can lead to stool finding its way from the rectum into the vagina, and that can predispose to a woman having a rectovaginal fistula. And I talk about videos talk about fistulas in a different video, so you can refer to that video as well. And so when it comes to the ligaments and muscles, sometimes the muscles and ligaments can be so stretched that it causes tearing, ripping, and separation from their connective tissue attachments on the pelvic floor, that in the future can lead to prolapse, meaning a drop of the bladder and or uterus, or rectum into the vagina, or it can lead to incontinence, meaning leakage of stool and or urine, and cause issues of incontinence that way, urinary or fecal incontinence. And I have separate videos that talk extensively about that. As babies are delivered through the vagina, it can oftentimes cause so much stretching of the muscles that after the baby's born and the muscles go back, the muscles don't always go back the same way, and some women develop pain as a result of that, tension, spasm as a result of that, or the muscles around the sphincter can be either stretched, torn, that can lead to fecal incontinence, leakage of stool through the rectum or the anus. And so there are so many things, or the nerves can be pressed, and that can cause pain. Women then have pain with intercourse afterwards, or pain with emptying the bladder, or having a bowel movement. There can be pain associated with that after having children. So there's so many things that are in the pelvic floor that can be affected, obviously, when women have their children. So when we talk about causes of complications of childbirth, we know that vaginal childbirth is a major cause of that. A baby's coming through a very confined space, and it has to squeeze everything in the process. So that is pretty obvious and commonplace. Pregnancy itself is also a time where, as the baby's getting bigger, it's occupying space, stretching skin, stretching muscles. Oftentimes the core, a woman's core, is being stretched essentially. The hormones that are created during pregnancy also cause the ligaments and that connect bone to become more lax, we say, or weaker, so to speak. And so her center of gravity is different. The muscles are stretched. The ligaments are not as toned. And so these things can cause changes in a woman's pelvic floor after having babies. Women who are older, and even in this age, a lot of women in their mid-30s, 40s, and have children, and healthy children. But we do know that the older a woman is, the greater likelihood that there can be either a complication or an injury that occurs as a result of childbirth compared to women in their younger 30s and 20s. And so, these are just some of the risk factors. Vacuums assisted deliveries or forceps assisted deliveries is another reason why some women develop issues with their pelvic floor after having children. If a woman's near having a vaginal delivery but she needs a little bit more assistance, then oftentimes the obstetrician could consider placing a vacuum cup or a forceps to help to facilitate that delivery. But in the process, that extra instrumentation, we call it, can cause more issues with the muscles, the nerves, and the organs in the pelvic floor. And so those are things to consider. With C-section, granted, women who have C-section have less of a risk of developing pelvic floor issues compared to women who have a vaginal delivery, but it still doesn't negate or doesn't eliminate those risks. Why? Because C-section is a major abdominal surgery itself. And so with major abdominal surgery, yes, there can be either thermal related injury or cutting injuries, crushing injuries, their organs, and it's major abdominal surgery, scar tissue. So it's not without its own potential risks as well. And prolonged pushing or having a big baby or pushing for a long time, these are reasons why women have pelvic floor issues after having vaginal childbirth. So I know I said a lot. So in terms of solutions, there are solutions, and oftentimes women may wait and feel like, oh, it's just going to go away. It's just going to go away. And guess what? In a lot of situations, it does go away. Time does heal a lot of those wounds, so to speak. So we tell women who, after they have their children, to give it time, be patient, and oftentimes by the time the baby is 6 months or a woman is a year out from having children, their child, these sorts of symptoms that occur, difficulty with emptying the bladder, difficulty emptying the bowel, pain, pressure, a lot of those things do relieve itself. However, when they are not getting better, or if a woman is interested really in intervening and getting treatment sooner, then what's been very, very helpful for a lot of women is pelvic floor physical therapy. And as urogynecologists, we work closely with physical therapists who are specially trained in female pelvic floor health, who we would refer you to and have you see. And a lot of times our patients will see the therapist once or twice a week for about an hour or so over the course of 2-3 months. And a certain bladder program is created so that a woman can start to rehabilitate her pelvic floor function. I mean, think about it. If an athlete gets an injury, they either need surgery or not, but then they're oftentimes going to need physical therapy. Women have children, deliver babies, thankfully. We appreciate women for being able to do that through the pelvic floor, but oftentimes she then goes back to work, whether it's 6 weeks, 8 weeks, 3 months, or 6 months or a year, whenever it happens, or she works in the home, or she just goes by taking care of her family. But a lot of women don't get the help that they need in terms of seeing a physical therapist and getting help, getting the muscles, the nerves, and everything working back together again. So physical therapy is key. Lastly, there's some women who need surgery. If there's a tear into the rectum that's causing stool coming through the rectum, fecal incontinence, or fistula, stool through the vagina, or urine through the vagina from the bladder, another fistula, or if there's prolapse, or meaning things dropping out of the vagina, or if there's pain, then these things oftentimes may require procedures to help to address them. Or some women may find that after they have their baby, that their vaginal muscles and vaginal opening is just very stretched, and and it's impacting their activities. Air may be getting trapped in there, or it's affecting their intimate relationship where they don't feel the same as it did before surgery. That can also be addressed surgically. And so there are different things that can be done to perform reconstructive surgery to help to improve a woman's quality of life and improve the support and function of her pelvis. So I know I shared a lot. As urogynecologists, we take care of these conditions week in, week out, and we like to let our patients know, as I do, that they don't have to live or put up with it. There are good solutions, options that are helpful. I do see a lot of patients who are referred to me, or even women who are seeking a second opinion because they've gotten a certain opinion from one place and they are looking to speak to a pelvic floor specialist regarding their options and the potential solutions. So it's important not to put it off too long, get help, seek a referral, and that oftentimes is the first step to better quality of life. Well, thank you so much for listening. If you want more information, my YouTube channel is available, as well as my website, www.stephentugbiyele.com. My practice website is Northside Center for Urogynecology.com, and our office number is 470-325-1280. I'd love to be able to help you if you find yourself in that situation after having your child and that you need help, and we'd love to be able to help you here and get you better, and so that you can then focus more on growing and enjoying your family. Okay. Thank you so much for listening, and if you know anyone who can benefit from this video, please do share, because a lot of women are embarrassed. They feel like they're the only ones. So if you do share with someone who you feel would benefit, I really appreciate it. Subscribe, and until next time, take care. Bye.